Great, thank you very much. So yes, this is going to be about identifying the social value of Revoe Library. Um, so, well, obviously you know all the funders. So yeah, so this is about social revolue. I really tried to get a pun in there. So, revolution was already taken, but we'll go through. I'll give you an executive summary of our findings, do a bit of an introduction to the project, then I'll go through the methodology that we used and the findings that we made, and then very importantly for Blackpool Libraries, the recommendations based on based on the outcomes to the research. So to get your interest at the top, an executive summary. So this was a social value-based data project. So we identified the extra monetary social value for Revoe Library. And we used a research methodology that combined desk research, qualitative analysis in the form of surveys and focus groups, and then data analysis to evaluate the value of the library. So despite its small size and opening hours, the library produces a base value of 1.4 million annually. And so this is a library that's open half the week, and a social return on investment of 10 to 1. That's at the base level. As we'll go through later, we did use some other health multipliers that could take the social value as high as 9 million, which is incredible for such a small library. And more important, perhaps, than those figures, we found that the people of Revoe really rely on the library for many things, including their mental health, and it really helps reduce social isolation and loneliness, among other things. So it's a really valuable part of that community. So as mentioned, the project team was Libraries Connected, Blackpool Libraries, and Insight Econ, who is a health economist, Professor Emeritus from the University of East Anglia, who did the data analysis for us. So some key terms. So I'm sure a lot of you are familiar with social value, but just in case anyone isn't, so that is value based on impact, not cash value, and that's through improvements made to community well-being. Social return on investment, that's social value compared against running costs. And I'm going to mention the eVols tool a lot. So that is the tool we used for our data analysis, and that is the economic value of libraries tool. And that was created in a prior bit of work for Libraries Connected, and I'll go into how that works later on. So, introduction. So the background. So this work we saw at Libraries Connected as a follow-on to our Libraries for Living and Living Better report, which was published in 2023. And that was a project undertaken by the University of East Anglia with libraries in the east of England, so Essex, Southend-on-Sea, a less good seaside resort. And that found that libraries create an annual value of 3.4 billion across the country. And the eVols tool was created as part of this as a sort of little extra so that library services could go away and use it and do their own analysis. We wanted to test it on a branch library, see how it could work on a smaller scale. And it happened to be that when we came for a visit to Blackpool Libraries, we were told about the difficulties faced by Revoe Library around the by-election, when they were told to close for, it could have been for a lot longer, it wasn't as long as they were initially told for use during the by-election. So we saw a real opportunity here to test it so that we could help the library build up evidence. So if something like that was to happen again, Vicky and Alan and the team at Blackpool Libraries could say, well, you could close us, but this is what you will be closing, this is what you will be affecting. So Revoe Library, it is one of the smaller libraries in Blackpool. So it's 8th out of 8th for visitors and 6th for book issues. Obviously, a really important part of social value, and for me, is not having data in isolation. So you might see that and think, well, that's very small, but a lot of this report will go and say what amazing work it does despite that. And just because it has smaller visitor figures than, say, elsewhere, that doesn't diminish any of its importance to those visitors. It's open half the week and 2 members of staff plus manager time. and there's a lot of PCs and a lot of computer support needed, as it is an area of digital exclusion. There's been lots of prior work undertaken by Blackpool Council and other groups to improve the digital inclusion in the area. So it's also the main public-facing council service in the area. That's something that came up in a lot of our qualitative research as well, how much people rely on it. And then it was forced to be closed in 2024 for the by-election, affecting the targeted outreach work, especially the work that Molly, who is one of the librarians there, and Lois were doing to reach the South Asian and Eastern European communities that are there, and this work was greatly affected by that closure. So the methodology. So like I say, we used some desk-based research, some preparatory work. There was then the qualitative data analysis and community engagement, the quantitative data analysis using the eVols tool and some other established methods that our consultant led on, and then the analysis, which in this case took the form of a report combining the narrative and the figures. So the preparatory work and the desk-based research. So first steps were to identify the running costs of the library. We did an audit of how the staff helped the community, which I think was a really helpful exercise for everyone to see all the little bits and see where the different focuses are. Some examples could include 15 minutes helping someone access council support on the computers, or 5 minutes helping someone print a vintage label, which is one of the main income sources for libraries in the modern world, to more just the things that you wouldn't think to register, but just Molly, the librarian on the desk, having a conversation with someone for 10 minutes who's having a hard time, and that's something that's incredibly valuable. We then looked at existing sources as guidance to fill in data gaps. So this was things like local demographics, evidence of established local needs, community information, and previous work in the community. For those, we used the JSNA and data from the ONS, as well as published research, which is all referenced in the report, which you can read on the Libraries Connected website as well. So the quantitative data, so this was performed using the eVols tool. So the way the tool works is it takes library activity value figures, and these were identified in case studies on common library activities or figures identified through equitable proxy research. So this was conducted by the team from the University of East Anglia, and that combined health economists, people more focused on creativity and education, and computer scientists. So there was a big range there. And then our consultant is a health economist, and he found other proxy research to help us specifically with this project as well. And he tested it and did things like adjusted it for inflation and tested whether it was a useful figure to use. So the tool then takes the value and multiplies the base value by the input figure, so event attendance, book loans, things like that, to create a specific social value. Now, just to say, social value is quite messy, as I'm sure a lot of you know. It's trying to quantify something that is very difficult to quantify. So as part of this, the tool has to make assumptions. So it would be impossible to say here, for things other than book loans, where you have the value of the book, that this is how much money this would create, but we made sure to get it as close as we could. So yes. So the data that we used, the annual footfall was used as a basic value multiplier, and in one of the levels, this was then adjusted for social deprivation by a weighting of 1.3, which is based on the research that shows people in deprived areas use equivalent resources to 1.3 people elsewhere. The index is primarily health focused because we believe health is a good indicator of general social well-being. We did then go and look at other aspects of the library offers. Loneliness was assumed to be at the UK national average, that's 7%, though it is believed to be higher in Revoe's catchment area. though this somewhat depends on how loneliness is defined, from mild to severe. And we did find some other figures, but we weren't happy with them to use as a higher one, so we kept it at the base level in order to keep it our findings conservative and more honest. So the scope of the valuation was taken from 3 perspectives: the various range of services and activities currently offered through the library, the potential health benefits generated from related activities that may have an impact on the health of its users, and the potential benefits from reducing loneliness from participation in library services. So things like the money that would be saved through interventions further on, and what the equivalent cost would be if a similar activity was to be sought from a commercial venue. And just to say as well that the reducing loneliness aspect, a lot of the work going on at Revoe is connected to the Know Your Neighbourhood project, which is a nationwide initiative and shows the need and also the good work that's already going on in Revoe and Blackpool libraries. So we use the eVols method, but recognise the wider health and social benefits are more complex to address, and the benefits may be indirect and not occur systematically or with the same intensity for different users. So we have shown the results in 4 different levels using combination of values and multipliers to allow for different perspectives. In other work, and we would have liked to have maybe gone deeper in the community consultation, but there were issues affecting that that meant we used this method instead, which we'll go into. So the qualitative data came from stakeholder engagement. We spoke to users, staff, and partners, which is really important to know not just what the community wants, but how the staff perspective on that, because the best people to say what might work or when might be best to hold a thing are the frontline library staff who know the ins and outs, not only of the lives, but of the areas. We had our community representative as part of the project team, Bev, who was excellent and helped us with the focus groups, helped us with the surveys, and was great help throughout and helped get other people to open up and talk to us, which was especially helpful with what's currently going on in Revoe. Staff also recorded and relayed relevant conversations and testimonies. And we did 2 phases of consultations. The first was more general, and the second responded to findings and was more specific and had more of a focus on things like loneliness and mental health, because that's what came up in the first round. So the formal structures allowed us to ask awkward questions relating to physical and mental health, and this was vital in guiding and evidencing the data analysis. And the focus groups especially helped illustrate tricky things to measure, such as loneliness or social isolation. And we had open conversation on the topic, and we were able to gain insight on these issues and learn how it influenced their library use. If we'd been able to do more for the community consultation, we may have used things like the Warwick-Edinburgh scale or the Wellbe scale to generate those mental well-being points. But luckily the focus groups, once they got going, people were incredibly honest and they were really, really great. So like I say, there were some barriers to this. So the wider issues caused by the massive regeneration project affecting the reception of the consultation, causing low take-up of surveys and focus groups. The Revoe Library is used as a venue for these consultations about the regeneration project. So there was a lot of hesitance to that, and it is also a common issue within the library sector. Often when people see their library doing a survey, they presume there's going to be a closure, and that can make them not want to participate in that. So we did reassure people, say it's not part of the regeneration project and the library will not be closing. The opening hours and staff availability meant the focus groups had to be held during work hours, which obviously affected who could attend. We used printed surveys over digital ones, because like we said, it's an area of digital that needs help with digital inclusion. And the staff, so Alan, Molly, Lois, and many others were really great in having those conversations and providing support to people filling it in. And like I say, Bev was an excellent champion to get people to help us out with the surveys. So the analysis, this was bringing it all together in the form of a report, ensuring the findings were complementary, combining narrative and figures to create fuller pictures, including any negatives. We wanted to be absolutely honest. Luckily though, there were very few negatives, certainly from the community perspective. One person wanted more space for study, which to have that be the main gripe is an excellent thing. This then allowed us to create the recommendations based on the findings. So qualitative findings, 85% rated the library as exceptional, and over 75% of responders visit multiple times per week. And a lot of them don't just visit Revoe, they visit other libraries within the service. Multiple attendees spoke about the library being their main social outlook, whether attending groups or dropping in to see staff and other users. Over 90% rely on IT provisions, whether that's the free Wi-Fi or asking staff for support. And users use PCs and ask staff for help for things like job searches and digital literacy skills. A few people raised the point of not knowing what to trust online, so staff help with that. Like I say, no negatives, only wanting more, whether that's more formalized IT support, more social groups, or more staff-led book groups or shared reading, and more structured creative groups. So a very popular art group is held in the library, and people love the structure of it. They have 1 week with the teacher and 1 week off where they can practice their skills, and they loved that. The fact that they were learning and growing together and it gave them a goal to work towards was absolutely excellent. And the work of this group was shown in the Grundy as well, of which they all had a trip to see. So in the more focused survey, we found 80% felt visiting the library helps with loneliness, and 93% say it helps with their mental health through social connection or engagement with groups and activities. One thing that came up repeatedly was how helpful the staff are, and Revoe is really good, and Blackpool libraries in general, like staff work at those libraries, so more often than not, visitors to the library know who they're going to see. They know what to expect, which can't be said for a lot of other library services. So with Molly's been mentioned and Lois and everyone, it's so friendly. They know if they go in on that day, they will likely see that person. They know what they'll get. They know they'll be asked how they are, and that's just something that, again, you can't put. Even though we've tried, you can't put a value on it. Many rely on the library to access digital health services, so booking a GP appointment, renewing prescriptions. There's also the NHS app, which libraries are providing a lot of support with as people are pushed to using that more. And over half the responders use Bookstock and PCs to research an illness or condition. So one attendee mentions using the Reading Well collection to understand their anxiety-related diagnosis, and felt reassured by the curated nature. So Reading Well is a collection of books curated by the Reading Agency with health professionals, and it covers a variety of health issues, and it can be more medical books such as dealing with anxiety, or it could be, for example, I don't know, the comedian Susan Calman's book about living with depression. So you get different aspects to do with conditions, and given the current nature of GP appointments and the timing of those and how difficult they can be to get, it offers people a lot of support that they know that they can trust to help them understand what they are experiencing. So the focus groups, there was a consensus that social activities in the library are vital to their mental health. They bring a sense of community and give people a reason to leave the house and interact with and meet new people. There was one lady who said that after the death of her husband, that it was going to the library and going for a specific event was the first thing that made her leave the house and feel confident and ready to go back in, knowing that it was low pressure and that everyone there would be friendly. As library events are free and in a welcoming space, people felt less pressure, so found it easier to take the first step and find that consistency. And the regular library events help massively with mental health. Quite a few people said that they use events at Revoe and at the other libraries to structure their week, and it gives them those reasons to leave and to something to look forward to. It's also less pressurized than a specific mental health group. So even with the art group, it's not publicized as for mental health. It's part of Know Your Neighborhood, but it's not art group to end loneliness. It's art group. And people found this really good because it meant any hesitancy to joining, they didn't think, oh, I'm going to go, but they're going to ask me about my anxiety or what I think about death. They're going to I'm going to create something, and then if those conversations happen, they do, and that actually helped people open up more. And for some people, they can go and talk about how much they love War of the Worlds and how they're creating it on stage, and both things are incredibly important. A common thread of the library and its library and its staff helping reduce the stress and anxiety around cost of living and access to wider council services. This is something we see across the library sector, as libraries are a trusted space and they are very public facing. And as cuts are being made elsewhere within councils, libraries are becoming a place where not only do people go themselves to ask for help, but they are also being sent by other departments. So one attendee was not only informed by library staff about a heating grant she was eligible for, but the librarian also sat with her and helped her access and apply through the online portal. So again, that's incredibly important. That's something that this person would not have been able to access otherwise. With all the signposting in the world, she needed that support, and luckily the librarian was able to offer that. When it comes to learning about and accessing services, the attendees would all use the library first, as they know it is when it is open and that they never need to worry about how the library staff will respond. They will always be kind and helpful. It's incredibly important. So these are the findings and the figures, and like I say, these are all in the report if you want to spend some more time really interrogating them, if we've got any people who are really into data. So we can see there the base level, so the total without health and loneliness, 1.3 million with an ROI of £9.66, but let's round it up to let's round it up to 10. So that's without the various health, so without health and loneliness benefits, and then without the health benefits, and without loneliness, and then underneath for weighted for social deprivation. So we see the rises again, and the bottom one with social deprivation, which, given that Revoe sits on the border between 3 wards, 2 of which are 2 of the most deprived in the country, we feel confident that we could use that as the base figure, taking us to the 1.4 million. And which also, just to say, comparing to other libraries across the country based on the prior work, it was found that branch libraries that are open full-time generate a value of 1 million. So Revoe, even without the adjustments, is above that, which is incredibly impressive and shows the great work the Blackpool libraries and the staff at Revoe do. So yeah, base value 1.4 million a year, rising to around 9 million if using all the health multipliers. We understand that the way social value is seen, depending who is looking at it, that figure, again, it's not a cash value. There have been conversations in other library services where people have thought that was cash. We know it's not the same as profit, so we would always use the 1.4 million as the main thing, but just to know that it could go up that level and to use it to show that impact is incredible. And the base social return on investment of £10 per user, rising to 70 per user with the multipliers. If you took that to any commercial business and said that's what we're getting, it'd be bonuses all round for the so that's an incredible value for a library, a small library in an area of high need. And whilst other venues could hold some of these offers, the way the library offers multiple things and wraparound support means it is a vital space for the community. So someone could go to a community centre or another venue for some of this support, but in the library where they could go in, so we had Bev told us about a day where she'd go to art group, she'd get some books, and she'd also use the computers to book her next GP appointment. So those values are stacked on top of each other and show that with libraries, it all happens in there. There's no limits, and you don't have to buy 4 cups of tea to stay all day. You don't have to get out after your knit and natter group because belly dancing are in next. You can stay in and use it all day. And in fact, knit and natter and belly dancing could go on at the same time. I don't know how each would feel about that. Or work together, knit some belly dancing outfits. So this is a quote from one of the attendees to the focus group. The library is so important for helping people with isolation, loneliness, and their mental health. The library and its staff help people before they reach a silent crisis. Now, all the other figures are important, and you need to take them to decision makers in the council or to funders. But to me, that's the most important thing. And certainly a small branch library like Revoe, that's the key thing that they can offer and that Revoe does so excellently. And that's what someone felt that they could share with us. And we've seen that stories of the librarians knowing people need help and them not asking for it, saying, you could get this grant. Do you want me to help you get it? So like, there's very few places where you can get that sort of support. So the recommendations, these were developed based on the report between Alan and myself. And the main one, increased opening hours and more staff. It's 1.4 million opening half the week with 2 members of staff, and the opening hours aren't even, I can never remember what they are. They're not. So imagine what it could do being open full time. An increase and more specific digital support. We know people coming to use the library for digital support, they've told us. So have more specific sessions, whether that's a tea and tech party where people can bring in their own tech to get specific support, or maybe running a session on how AI is already affecting people's lives, even if they're absolutely vehemently against AI or terrified by it, a way to reassure people that about it. Increased health partnership work. So there's already a lot of great work going on working with local NHS partners about specific things, but this work has shown that with a bit more dedicated mapping, it could really help target specific issues. More creative activities for adults, more mental health based offers without necessarily making it be too mental health focused. More council support for the community from the library. This could come in the form of resources or training, or just being given the information they will need before people come knocking at the doors, which I'm sure if Alan could talk more about if there's any questions around that. And then just more community mapping and reaching different demographics. As I said before the by-election, they were doing some really good work to try and reach the South Asian, Eastern European communities, and it was all really good. And unfortunately, the closure massively affected that. So now that we know all the good that's being done, the library could start looking outwards and think, how are we going to get those people back in? How can we help those people at a time when, you know, like everyone else, they probably would need and appreciate that help and support. So 1.4 million of value, at least, but only open half the week. That is Revoe Library, and that is the end of the presentation.